If you're undergoing a prosthetic or implant-based breast reconstruction, the question that will inevitably come up is whether the implant should be placed on top of or below the pectoralis or chest muscle, what's called a subpec or pre-pec reconstruction. The bottom line is they're both considered standard of care, they're both excellent options, and in the right surgeon's hands, they can both do well aesthetically and they can be done safely. But there are sort of advantages and disadvantages to each. If the implant is placed underneath the pectoralis muscle, it requires a little bit of additional dissection. It's not the standard anatomic plane for the breast to be. And so you can get something called animation deformity, where when the patient contracts their chest muscles, the implant moves. And it can be a little bit more painful because the implant has to go under there. But the advantages are you get that extra layer of protection for the top of the implant where the muscle sits. And so you're going to see less rippling, and it'll tint the muscle out to give you a more gradual transition in the upper pole of the breast. And so that means it's sort of the advantages of the pre-pectoral reconstruction are the opposite. It's less dissection, presumably less pain, no animation deformity, but you may have a little bit more contour issues in the top of the breast, which you can usually address with fat grafting. At this point, the majority of surgeons are doing pre-pectoral reconstruction, but subpectoral is totally fine and is a great option. And surgeon and patients basically have to decide together what the best option is for each person.